Hey everyone, and welcome to this lecture on study designs. This is a commonly tested concept that seems to trip up a lot of students, so hopefully I can make it easy and straightforward. So I think for most studies, we can really use this very simple algorithm to try to figure out which type of study design is being described in the question stem. So the first question you want to ask is, are patients being randomly assigned to treatment groups? So we know if patients are being assigned to treatment groups, then this isn't an observational study. And if it's being done randomly, which is often the case, then this would fall under the umbrella of a randomized clinical trial. So as we can see with this diagram in purple, you have a group of patients. They are randomly assigned to a placebo or to a treatment, and then the outcome is measured. And the measure of association in this group will be a risk ratio. So a question I've seen related to randomized clinical trials is, what is the purpose of the randomization? And in essence, the main reason why we really love randomization is that in theory, it should equally distribute possible confounders between our two groups. So medical comorbidities, potential demographics, possible confounders that could lead to the appearance of an association where one truly doesn't exist, are basically mitigated in randomized clinical trials because those possible confounders should be equally distributed between our two groups. So that's the simplest case. What happens if patients were not randomly assigned to a treatment group and we are dealing with some sort of observational study? Then the next question you want to ask yourself is, how were patients grouped in the study? And there are really three main types of groupings. So the first is that patients weren't really grouped by exposure or outcome. And, exposure and outcome were measured at one point in time. Things like surveys, interviews tend to really fall into this bucket. This type of study design is a cross-sectional study where we have a group of patients, and at one point in time, we're asking what's their exposure status and what's their outcome status today. For example, if we did a survey and said, do you smoke and do you have lung cancer today? That would be an example of a cross-sectional study. And because this is really taking measurements at one point in time and is not a longitudinal study, importantly, we can only really measure prevalence in this case. We cannot measure incidence. So that's an important thing to keep in mind. The next group is if patients are grouped by exposure status, so patients with or without the risk factor. If that's the case, then we're dealing with a cohort study. So as shown by the graphic in purple, you have one group of patients with the exposure, one group of patients without the exposure, and then you're asking, what is the outcome in each of these groups? In this case, the measure of association is a risk ratio. And a key idea that really trips up a lot of students is that cohort studies can be prospective or retrospective. So you can't use, whether a study is prospective or retrospective to decide whether it can be a cohort, because it can really be either case. In reality, you just really want to think, are patients being grouped by exposure status? And if so, then you're dealing with a cohort study, regardless of whether it's prospective or retrospective. Lastly, if patients are grouped by outcome status, then we know that we're dealing with a case control study. So in this case, you have one group of patients with the outcome, one group of patients without the outcome, and you're asking yourself, what is the relative amount of exposure in each of these groups? And one highly testable concept, which I'm sure you've come across, is that in this case, the measure of association is an odds ratio. It is not a risk ratio. And there's a very complicated, nuanced statistical reason for that, which I think goes above and beyond what's needed for the test. But just remember, if you ever see a case control study, you know that you must do an odds ratio. And one other fact related to case control studies is that they are a very efficient study design in the setting of rare outcomes. We could imagine if we're looking at a certain cancer, which is seen in 1 in a million patients who don't smoke and 10 in a million patients who do smoke, we could see that smoking plays a big role as to whether the patient gets cancer or not. But if we were trying to, determine that through a cohort study, we would need to look at data on millions and millions of patients, and it's, very inefficient. But when we do a case control study where we're taking patients with the outcome, patients without the outcome, and then looking at exposure status, it'll be much more efficient because we're already saturating our sample with patients with this rare outcome. So that's another important thing to keep in mind. And then lastly, just for completeness sake, sometimes there are two other study designs that are listed as possible answer choices in these questions. One is a case series. So this isn't really looking at an association. This is more so something that's a description of the clinical course of a small number of patients who have some disease, often, less than 50 patients, more commonly less than about 20. And this tends to be very rare outcomes, very rare diseases where, it's something that's new, and it's just a way for researchers to really describe this case such that people can begin to pay attention to it. And then the second is an ecological study. So this is an observational study where the data are analyzed at the group level. So this is different than all the other studies we talked about, where patients are grouped on the patient level. In an ecological study, patients are analyzed at the group level. So for example, an ecological study would be comparing the prevalence of cancer in Los Angeles versus in San Francisco, because we're not looking at patient by patient who has the disease, who doesn't have the disease. We're just looking in this big group, patients in LA, patients in San Francisco who has the disease. So those are two other less commonly tested study designs. I really think the best way, especially for this information, to apply it is by doing some of the practice questions associated with the lecture. So as always, I encourage you to take a stab at those and really see if you understand the material or whether you need to rewatch the lecture. As always, please like, comment, subscribe, and good luck.